Hi, my name's Dave Tatham. I'm a GP in Bradford. I'm the clinical lead for urgent emergency care across Bradford and Craven. We've put this video together to give you some top tips on staying well this winter and how to look after yourself if illness does strike. So the first tip is to be prepared before illness strikes. If you're eligible for a flu jab, make sure that you take up the offer from your GP or your pharmacist. And if you're not sure whether you're eligible for a flu jab or not, contact your practice and they'll be able to offer you some assistance. Secondly, make sure you have a well-stocked medicines cabinet at home. Many minor ailments over winter, such as coughs, colds, runny noses and diarrhoea and vomiting that doesn't last more than a few days, can often be managed without having to see the GP. And if you're not sure of the best things to keep in the medicine cabinet at home, make sure you speak to your local pharmacist who'd be able to advise you. Thirdly, if you're not sure what to do and you do develop some symptoms over winter, there's loads of helpful advice on nhs.uk. And there's a helpful symptom checker on there, and that website is fast and free and easy to access and can direct you to the right place in the NHS. So the second tip is around what to do if you do start to feel unwell over winter. First thing to think is there anything you can do to help yourself at home? And with a well-stocked medicines cabinet, most simple symptoms can be managed. Fever or sore throat can be managed with simple paracetamol. If you're not entirely sure what to do, your local pharmacy is a great first port of call. Pharmacists are qualified to give general advice around minor ailments and can provide you with many medicines that are available without prescription. If things are getting worse and you're not sure what to do, NHS 111 is a great source of advice. It's a free phone number, it's available 24 hours a day, 7 days a week, including all bank holidays and national holidays. NHS 111 can make sure that they point you to the right place in the NHS system, or if necessary, book an appointment with a doctor. The third tip is for people who have an existing medical condition which can often get worse during the winter months, and often respiratory conditions can be much more challenging to manage. We generally recommend, if you do have one of these conditions, that you make a note of what's normal for you, and it's sometimes helpful to write those symptoms down. And if you do start to develop symptoms that are different to usual, that you ask for help early via your GP practice. It's often an unpleasant place to be in hospital over the winter, and with regular conditions that seem to get worse, early help can often prevent a hospital admission. So please don't be shy at asking for help fairly early if you do have a long-term condition. The A&E departments locally can be very, very busy even at the best of times, but over winter, when people tend to be more unwell, can be extremely busy and result in very long waits for treatment. We'd urge you, if you haven't got a problem that's an accident or a life or limb-threatening emergency, to use NHS 111 or your GP or your local pharmacy for advice about the best thing to do. It frees up time in A&E and makes sure the most sick patients can get the care that they need in a timely way. Following these top tips will help us to help you stay well this winter.